CEO of Wellframe, and this is Vinny, my co-founder and CTO. Wellframe is a Boston-based team with Harvard and MIT roots, who came together with a big vision to combine our expertise in clinical medicine, health data science, and artificial intelligence to build a GPS for health, a digital concierge that iteratively guides patients with chronic disease. Why? Because of patients like Bob. Bob was just sent home from the hospital after having a heart attack. He's afraid, he's uncertain about what to do, and he needs guidance to get back on track. In response to this problem, Wellframe's developed an intelligent system to support patients like Bob toward an optimal recovery. Having successfully completed our first clinical trial, I'm thrilled to announce the launch of Heart Coach. Here's how it works. This time, Bob sent home from the hospital with the Heart Coach app installed on his mobile phone. Just like a GPS provides turn-by-turn guidance, Heart Coach offers Bob a personalized task list to help simplify the day-to-day of overcoming heart disease. Bob's daily tasks are based on a validated clinical protocol, but dynamically adapt according to his progress through the program, using our proprietary machine learning algorithms. When Bob wakes up, he receives a morning medication reminder based on his prescription schedule. Bob knows that this is the right thing to do, but he needs a little bit of help to stay on track. He then notices a message from his nurse, Karen, who he met in hospital. Karen's been monitoring his progress and sending him regular feedback to help Bob feel cared for even at home. Today, Karen gives Bob a reminder that he has a follow-up visit with his cardiologist, Dr. Gupta, later that week. Over breakfast, Bob watches a short educational video recorded by his physician. Today, Bob's video is about potential side effects of his medications. Bob's medications, to learn more, Bob can go to our content library to get more information about anything and everything related to his condition. He then answers a follow-up question, asking about potential symptoms that he might be having. This information is sent securely to his nurse, Karen, who is able to provide him with remote guidance. Later that morning, Bob goes for his daily walk, which is essential to strengthening his heart muscle. Bob tracks his steps with Heart Coach, which uses the phone as a pedometer to share objective information about Bob's daily activity to Karen, his nurse. After his walk, Bob checks his feed and notices a message from his daughter. Wellframe offers reassurance to Bob's family by giving them daily updates about Bob's progress. All the while, Bob's nurse, Karen, is monitoring hundreds of patients remotely with an intelligent dashboard. Wellframe uses signal processing and pattern recognition to help Karen more efficiently allocate her resources across a large panel of patients. Karen receives an alert indicating that Bob has a question about some symptoms that he's been having. After reading Bob's question, Karen responds saying that based on his description, the symptoms that he's been having are unlikely due to his medications, but recommend he check with his doctor later that week. Wellframe is turning our vision of a GPS for health into a reality, and we're now bringing on our first hospital customers, with the aim of helping the 16 million Americans currently living with heart disease to better manage their health. We're also working with some of the nation's top medical centers to develop programs for other patients, including those with congestive heart failure, pulmonary disorder, and mental illness. If you're a prospective partner or investor with an interest in joining our mission, we would love to chat with you. But now back to Bob, who after receiving a response from Karen, feels reassured knowing that he's getting support toward optimizing his recovery. Thank you.
So I have a question about the customer. Is the customer primarily the hospital, the doctor, or the patient?
Yeah, so the customer,
or the insurance.
The customer includes hospitals and health systems that are increasingly taking on financial risk among patients, especially in the post-acute window.
And so once you have a hospital on board as a customer, what has to be done in order to get the doctors to use this? Because there's a lot of effort for the doctors to be able to record the videos and keep in touch.
Yeah. So our system's not typically used by doctors. It's used by nurses and what we call case managers. And these are particular individuals that are tasked to follow for health systems that are employing more and more of these nurses to follow the patients. And right now, the only ways they have to do that are to make a visit or to have a phone call. So our system is like an efficiency tool that allows them to reach more patients more efficiently, more effectively, more intimately.
So is the patient paying anything for this, or is it just the way the hospital is going to take care of their patients?
Yeah. So at this point, the patient doesn't pay anything. We're really looking at the healthcare stakeholder that's bearing the financial risk over the patient as the customer. There is an opportunity for patients who might want to stay on the program for a longer period of time to pay them, but that's not our focus initially.
And your initial use case is heart surgery or people having heart attacks. How you develop sort of the library of content that you need for different types of disease?
Yeah, so we're working with clinicians and experts to find the best possible sources of content, iterate on that, make it conducive to this sort of format. And we've developed a content library for patients with coronary heart disease, as well as a number of other conditions as well that we'll be rolling out in the next month.
And as you work with the hospitals in trial, what are the metrics that they're looking at to decide if this is something that's going to be beneficial for them?
Yeah, that's a great question. So we kind of see a value or a ladder of value. When we start off showing that clinicians and patients are engaged and that they find the system to be valuable, that we can give clinicians new insight into what patients do. Longer term, we're really looking at clinical and financial outcomes like rate of hospital readmissions, rate of recurrent events, or even some kind of biomedical or behavioral outcomes.
Price point?
So right now we're licensing our solution to hospitals and clinics, and the price point will be based on the number of patients. We're trying to keep our price point fairly low early as we get adoption, and then as we start in cardiovascular, we see opportunities to move across other disease areas as well.
And what is the primary barrier to being able to get a hospital to adopt this kind of test?
Yeah, so we're really proposing a technology-enabled process redesign. So the barrier would be any kind of inertia at the hospital level to change the processes of care management, but we're really looking at hospitals that are already going through change and investing in new resources to do that, so that's how we qualify an expected customer.
The loop with the family that you mentioned, is that sort of a fee that you get of the activity of your parent? That's the person who's sick, or?
Yeah, so this is typically designed for a spouse or an adult child who wants to get updates on how their family member is doing. So they get a daily update showing what the patient's doing and how they're doing, and then they can send secure messages of feedback or support.
What's your view on just how access to data can help people become healthier? I mean, that's what your whole business is based on.
Yeah, I think that there are two different sides.